This video demonstrates a simulated endotracheal intubation using the OUH checklist for intubation of critically ill patients with confirmed or suspected COVID-19. This checklist is an adaptation of the OUH standard checklist for intubation of critically ill adults, but with small adaptations to maximise the safety of staff and patients when there is suspicion or a confirmed diagnosis of infection with COVID-19.
So we're outside the room of patient X who requires intubation, and we're going to go through the COVID-19 tracheal intubation checklist. I'm going to start off by confirming the resus status of the patient.
The patient's for resus.
And Trev, does the patient have any allergies?
No allergies.
So we're going to start by allocating roles in the team. So I'm going to be the airway lead, the most senior airway doctor. Trev, if you're happy being the airway assistant. Tori, if you could be the second airway doctor and be in charge of drugs and monitoring. And Laura, could you be the first runner? So donned in full PPE but outside the room, and you're in charge of accessing further kit if we require it, in particular front of neck access. And there's also a second runner who's not donned and is in the clean area who you can communicate with if need be. So we're going to move on to the preparation. So we prepared drugs, and Tori, if you could just go through what you've prepared, please.
Yep, so we have an induction agent. We've got 100 milligrams of rocuronium. We've got a vasopressor and a saline flush. We've also got our resus drugs ready and available. And Laura, if you wouldn't mind getting ready the post-intubation sedation.
Okay, so we're going to go through the equipment. So this is all pre-prepared on the intubation trolley, and this is going to go into the room with us. So we have a face mask, Goodell, we have a water circuit with inline suction, HME filter and capnography, which have been pre-arranged. We have 2 endotracheal tubes. We have lubricant, a syringe, an eye gel, an ETT clamp and gauze. We have a video laryngoscope and MAC4. We have a stylet and bougie available. And we have an NG tube and McGill's forceps. Of note, the front of neck access pack is outside the room and can be accessed from the airway trolley. Okay, so we're going to move on to the airway plan. So we're going to give the induction agent and rocuronium together, Tori. And I will be holding the face mask on as pre-oxygenation, and I'll be avoiding face mask ventilation during that time. Plan A will be a tracheal intubation with a video laryngoscope, and I'm going to use a bougie. I'll have a maximum of 3 attempts, and if failing, I'll declare a failed intubation, at which point, Trev, if you could communicate to Laura outside of the room to access the front of neck access pack and to bring that into the room. So plan B, to maintain oxygenation, will be an eye gel, and failing that, we'll move on to bag mask ventilation, which will be a two-handed, two-person technique. So I will maintain the airway, and if you're happy to ventilate. Yep. If we fail at that, I'll declare a can't intubate, can't oxygenate situation, and we'll move on to plan D, which is front of neck access. So that time, if you're happy, we can swap roles. So you will come around and hold the airway, and I will be performing the front of neck access. Yep. Following successful intubation, we need to ensure that we have a secure airway before ventilating. So Trevor, I want you to inflate the cuff while I attach the water circuit, and I'm not going to ventilate the patient until I'm happy that the cuff is inflated. Okay, does that all make sense? Yep. Everyone happy with the plan? Okay, so it's time, I think we can move inside the room. Okay, so now we're going to go through the inside the room checklist. So we're just going to go through 3 checks before drifting off to sleep.
Yep, so patient optimisation. So Ben, are you happy with patient positioning?
Yep.
And you confirmed front of neck access site?
Yep, confirmed.
And we've got our monitoring established. So we've got our ECG, we've got our SATs, we've got our blood pressure and our end tidal CO2. We've got our face mask, inline suction, HME filter, capnography and water circuit.
I'm just going to switch this mask over now, sir. So I'm going to turn off the oxygen to the non-rebreathe mask just to minimise aerosolization and replace it with the face mask, which I'm going to secure with 2 hands.
So we're going to consider a vasopressor and fluid bolus if needed, and aspirate an NG tube if there is one. So now we're going to go on to our pre-intubation check. So Trev, are you happy the IV access is working?
And that's working well.
Ben, is your suction on and under the pillow?
Yes.
Trevor, you happy with ventilator settings and our sedation for post-intubation?
Yeah, they're all set up.
And we've already confirmed our drug doses and we've written them on the whiteboard.
Okay, so we've adequately pre-oxygenated. So we're just going to drift you off to sleep now, okay? Okay, if everyone's happy, you're happy to give the induction agent.
Yep, so induction agent going in. I'm going to give 100 milligrams of rocuronium. And I'm just going to flush that in now and we'll start timing for a minute now.
And I'm not going to hand ventilate the patient unless clinically indicated.
And that's 50 seconds.
Okay, so if I could have the video laryngoscope, please. Okay, and the bougie, please. Thank you. That's it. And the ET tube. Okay, have you got the bougie?
Yep.
Okay, tube in, so bougie out, please. Thank you.
And cuffs inflated.
Okay. Confirmed clinically, we have bilateral chest movement and we have end-tidal CO2. Okay, so if we could secure the tube, it's at 20 centimetres at the teeth, and we're also going to place an NG tube. Thank you. Okay, if we could secure that at 64 centimetres at the nostril. Okay. All right. So now we're going to proceed to transfer to the ventilator.
So we're going to turn down the oxygen to the water circuit. We're going to clamp the ET tube before we break the circuit, and then we're going to disconnect the water circuit from the capnography, connect to the ventilator, and then unclamp the ET tube before we start ventilation.
Okay. Everyone happy?
Yeah.
Okay. So water oxygen's down.
CT clamp.
Okay, we've disconnected. Connected to the ventilator. If you could unclamp the tube and start ventilator. Okay, and we are ventilating the patient.
So we'll start some sedation, insert a central line and an arterial line, and then dispose of any dirty equipment.